Hello and welcome to the Daily Med. A lot of patients suffering from COVID-19 are dealing with cough these days. Cough can be either dry or either it can be productive, that is with phlegm. Markets are full of cough syrups and people are buying cough syrups without consulting their doctors. Patients are taking cough syrups and just after taking it, they feel chest pain or either rapid heart rate. Please take note and check if you are using TERBUTALINE or either salbutamol in your cough syrups. Taking these can cause tachycardia, that is increase in your heart rate. In COVID-19, patients already have oversympathetic response. Just by walking a short distance, patients feel that their heart rate is increasing. And by using cough syrups containing TERBUTALINE or either salbutamol, they can increase their heart rate more, thereby worsening their condition. Therefore, it is our kind suggestion to please call or consult your doctor before taking any of the cough syrups in COVID-19. Your doctor can prescribe you the right cough syrup you want, depending on your condition. If you like this video, hit the like button. If you want to know more updates on COVID-19, please subscribe to Daily Med. Do not forget to press the bell icon to get the notifications of our updated contents. Also, don't forget to follow Daily Med on Facebook. Thanks for watching Daily Med.